Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center. I'm also the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. And this evening, we're going to talk about advocacy, in particular, public policy advocacy. And our guest tonight is my friend, Threase Harms. Threase is the president and CEO of Advocacy Strategy. Welcome, Threase.
Thank you, Dr. Deming. Thanks for having me be a part of your program. It's so exciting. I love you. I love your work. I'm grateful for everything you do, and I'm grateful to be able to share some of my skills and talents and expertise with all of our friends.
Well, thank you. I always like to say that during my regular job, I get to reduce the burden of cancer one patient at a time, usually in half-hour time slots throughout the day. But when I go up to the Capitol and use my voice to advocate for public policy, you really have the potential of affecting millions of people with the outcome. So it's not either the or for me, it's both and I'm excited to talk with you about, the power of advocacy. Let's just start with that word advocacy, and and also the word lobbying. So we sometimes I go up to the Capitol. I'm not a lobbyist. I think of myself more as educating individuals, in particular lawmakers, about factual issues that can influence how they might vote on a bill. Maybe talk a little bit about that, the concept of advocacy and the concept of lobbying.
You bet. So, what's fascinating is that they are intertwined, but definitely not the same thing. And so, advocacy is really having your voice heard. It is generally, think about education, right? Like you have the opportunity to share your story, you get to talk about an issue that you're passionate about. As Dr. Deming said, it's the ability to have your voice heard. It's all of those things, sharing whether you're for or against a particular issue. It's taking your voice, your passion, your issue, and sharing that with elected officials. And that's something that you can do at a local level, at your city council, and your local community, all the way up to Capitol Hill. And I know that Dr. Deming, you've done it at all levels, and as have I. And so that's really advocacy. Think about advocacy as educating decision makers. So that's where the that's the role for advocacy and lobbying in particular. And that's more of what I do on a daily basis. So I've been a lobbyist at the State House for 30 years. This is my 30th legislative session here in Iowa, and born and raised farm-fed Iowa kid, by the way. And my first real lobbying job as a paid professional was actually for the American Cancer Society. So I've been working on cancer policy issues for my entire career. And I do remember it's when I first started, I didn't really, as a young woman, that a lawmaker said to me, with the stroke of a pen, you can change the lives of, many, as opposed to, maybe doing, raising a dollar or what have you. And so that always stuck with me. And that was something that I did as a way to recruit advocates, recruit people to do the work, to share their story, to help us advocate for, to be advocates for the American Cancer Society or for whatever organization that I am working on or behalf of. That's what we did. And so, but now today as a lobbyist, that's what I get paid to do. I very much enjoy it, and obviously it's a passion of mine. But I get to take the voices and words of all of my clients, and I go work with elected officials, and I make sure that they understand a piece of legislation, whether again it's something we're for or against. But that's I pound the pavement every day, and I'm there and I help facilitate conversations and help bring experts like you and others that can come share the stories and their expertise on issues, whether it's a personal experience or their professional experience, and come share that with lawmakers, because lawmakers are everyday folks. In Iowa, we have a citizen legislature, and those folks have day jobs, and they aren't experts in necessarily they can't be experts in all of the issues that they take on or that present before the legislature each and every day. And so they really rely upon us as lobbyists, and we really rely upon advocates like yourself to help us tell that story and educate them.
So, Teresa, let's define or get a little bit more specific. What makes you a lobbyist? I mean, are you registered? You get paid? What's the background? So, what's your personal background? What did you study in school? Are you a lawyer? Are you what makes somebody a lobbyist? And you mentioned that that's your profession. You get paid. So we'll start talking about who pays you to be there at the state house. But first of all, how do you become a lobbyist? Are all lobbyists lawyers?
Great question. So all lawyers aren't lobbyists. All lobbyists aren't lawyers either. So I laugh and say that I'm not an attorney, but sometimes I play one on TV. And but that was something I just never. I really never considered or was presented with when I decided to go down this career path. I always say that my career picked me. I didn't necessarily pick it. I was on my way out of the state of Iowa after graduating from the University of Northern Iowa. I have a communication studies degree. I had the opportunity to work in the legislature, and so I worked for in the Iowa Senate for a session because of my activities at the University of Northern Iowa. I got identified to come and work in the legislature, of which I did. I had a wonderful experience, and then from there, it caught fire, and I just decided that that's what I wanted to do for my career at that point in time. So. A job came open with the American Cancer Society. I made application, and that was my first, paid gig. So my
And
role. Oh,
and so when you go to the state house and you say I'm going to be a lobbyist, you have to register, correct?
yeah.
As opposed to I can go up there, just walk through the door and go talk to anybody that will talk to me. But as a lobbyist, you have to be officially registered.
Yep, we do. And so, as lobbyists, we're required to register for each one of the clients that we represent. And then we have to disclose how much they pay us. And we have to report that each and every year. We do that every July. And so, that is for every client that we would be talking to a legislator on behalf of. And then during the legislative session, we are required to register on each piece of legislation that we are talking to legislators on behalf of each one of those clients. So, as you know, I am a multi client lobbyist. So, I have my own firm, Advocacy Strategies, and we represent about 40 different organizations. And so we register on behalf of each one of those organizations. And then we register every day that there's a new piece of legislation that gets introduced that our clients are interested in. We make sure that we register, whether it's for that bill, against that bill, or if it's just something that we're trying to learn more information about or monitor. So then we would just register as monitoring or undecided, to let policymakers know that if they have questions, we are a resource for them. It also lets them know who's for it and who's against it. And is they're looking for more information, for example, if there's a question about how Medicaid, or why the occupational therapists want to understand or involved in the Medicaid discussion. They will come and say, why do occupational therapists care about this piece of legislation? And so then we have that conversation and help them understand why they're involved.
Okay. Is there a train near you?
There is. I'm so sorry.
Okay, good. We're wondering whether we're getting so that's okay. We can hear you fine. So a lot of times when you think about public policy, or when I think about it, or I think about somebody on TV is saying something for or against, it's like follow the money. Who is supporting it? So I assume that part of this lobbying registration is everybody then can see who is paying you, and one can see who's paying the other lobbyists and where the money is coming from that is advocating one way or the other for various bills.
Yeah, the registration really does, and the registration not only as a lobbyist, but the registration for on pieces of legislation really provides great transparency. And that's one of the things that I really do like about Iowa's system in particular is that it does force you, as do legislators. You can't really show up and talk at a subcommittee meeting and not be registered on a bill because somebody will likely call you out on it, or even a legislator will call and say, "Well, I don't see you on the registration." And so it's something that lobbyists at the Iowa State House take very seriously, from the perspective of, as we generally don't go lobby on a piece of legislation, even if it's just saying that we're monitoring the bill as we're trying to find out where our client. Is going to fall out on an issue, if it's something that they, support or oppose or wherever they land. But we take that registration process very seriously. And like I said, it's really it's a great tool to help policymakers understand, this is an organization that I support, or this is an organization that I'm interested in learning or knowing more about. What is their position, or why do they care about, or I didn't understand that why they would have an interest in this piece of legislation. And so it's really a great that transparency, that disclosure is a great education tool for policymakers as
Right.
well.
And then the payment structure for a lobbyist, do you have to report the number of hours that you worked on a particular bill for a client? And you obviously said you have many clients, and some of the clients that you serve may have the same positions on certain bills and the same interest in certain bills. So how does that work when you've got multiple clients that you're serving?
Yeah, great question. What's kind of interesting about that is probably one of the reasons I didn't ever want to be an attorney, because I didn't want to be able to track my time. I'm 15 minutes late generally for everything, and if I had to count time, it probably would never happen, and I'd never be able to charge my clients for anything. So, I most of contract lobbyists, excuse me. Work on an annual contract basis. So it's just a flat fee generally for the work that you're going to do, and then they pay you that fee for the work that you set out, whatever is that scope of work that you set out in your contract for your organization. As far as we do. Find it valuable to sometimes have clients that have um, issues. One, because it makes it a lot easier for us to track those, thousands of bills that are being introduced and run through the legislative process. And often we can talk about multiple issues. I had a subcommittee today where I had two clients. They were both opposed to the piece of legislation, and I spoke at the subcommittee and I presented as, the Iowa Farmers Union, and I spoke as to what their reasons were. And then I said, my other client is the Iowa Environmental Council, and here's the reasons that they oppose it, which are a little different. And so it's easy to do that. We also have a team approach here at our firm. And so we do have 5 professionals, 4 registered lobbyists at the State House during the legislative session. So we do a lot of divide and conquer as well.
And do you ever have two clients who have an interest in a bill and are on opposing sides of the bill, and you're the paid lobbyist for two different entities, each representing a different side?
Yeah, we do occasionally, and we actually have one right now that we're working on. And so, what we do, and again, the beauty of having a firm with several folks is we can recognize those generally. We know what the priorities are for each of our clients and where those conflicts may arise from time to time. We don't have it a lot, however, we do, and we know when it's coming, and so we just make sure that we have a lead for each one of the clients that we represent on our team. And then the lead person will be the responsible party for that client. And then the others just won't register on behalf. So, we have right now on the governor's energy bill, we have clients that are on um, that have different positions on that. Some are for, some are against, some are monitoring. And so we have divided our clients on that bill between our staff, and then each staff person just lobbies exclusively for that one client on that piece of legislation.
Let's talk specifically, and what I'd love to do is talk historically over your 30-year career on some, some big wins and maybe on some near wins that stick in mind. And I'd like to have this conversation about, public policy related to health in particular. So let's go way back to your first year as a lobbyist with the American Cancer Society. Do you remember what the issues were? And did you come away with a win that excited you about this new career that you were just embarking on as a lobbyist?
Yeah, that's a great I actually can tell you about my very first session, and I can tell you the tears that I shed and the, excitement that I had as well. That first year, I was thrown into an issue that I'd never worked on insurance issues in the past or ever in my career. It was brand new, straight out of college, and, we were working on off-label, prescribing for cancer medications. And I know this is something that's still not foreign today to prescribers, and many drugs are used in off-label situations. And this is, you think back, this was in the late 90s, and so it was a time when innovation is really just starting to take off, and there's not a lot of new treatments yet in the market, and lots of things in the pipeline, but people were willing to and to try anything if it meant that it would add time on their life and their cancer diagnosis. And so we wanted to make sure that insurance was willing to make accessible off-label prescriptions for cancer treatments when the physician was recommending that. And so it was never a win for me. I never won it when I was at the Cancer Society. I know it's an issue that was recently won in the Iowa legislature, but 20 years later.
So
But
back then, the bill was to mandate that insurance companies pay for off-label prescribing if it were for cancer.
correct.
And did it come down to the wire? Was it close or?
Nope. We actually, unfortunately, the person who was the chair of the House Commerce Committee, where the bill was, and I couldn't get it through the full committee, was then Representative Janet Metcalf, who unfortunately just recently passed away last week. And so she was a great mentor, taught me a lot of things through her lifetime, but she was responsible for a lot of my tears in my first legislative session, and teaching me, one, that you don't always get everything that you want, that there's different ways to skin a cat. You don't always get to the way that you think it's going to get done isn't always the way that it gets done. So I did learn a lot, but I don't remember any significant victories. Well, that's not true. That's not fair. In the first couple of years at the Cancer Society, one of my first victories was working on the multi-state tobacco settlement and getting the establishment of the state tobacco program. And so that was probably one of my first victories, and major successes, and one of the reasons that this state started to really embrace tobacco control, and it was the establishment of our youth programming and all the things that we never had previous to that. So
Right. And many things which we don't have anymore. But we can talk about that. But yeah. So how about before, because I do want to save time to talk about what's going on right now with this legislative session, but maybe one of your biggest wins over your 30 years that you think has had the most impact on the most number of people.
yeah, my proudest of all the things, and Dr. Deming, I know I've shared this with you over my years, but I became very passionate about tobacco control when I was 12 years old. My dad was diagnosed with non-Hodgkin's lymphoma, and it was very traumatic for me. My freshman year of college, 2 weeks before finals, my father passed away, and I always made it a commitment. I never wanted another young person to have to lose their parent in that fashion that way again. And so I became very passionate in working. So hence when the job at the time came available with the American Cancer Society, I was all in. I didn't care what they paid. I didn't care any of those sorts of things. I just felt like it was my opportunity to give back and try to make a difference for people every day. And so that's always been a mantra of mine in the work that I do at the State House. And I don't get paid to work on cancer issues every day, but there are things that I'm very passionate about personally, and so I just make them my priority because I have the ability to do that as because I have my own business, so I get to do those things. But having said that, so my most proud is the Clean Air Act. So Iowa
Mhm.
Smoke Free Air Act that was passed in 2008. It's 17 years old. We are still working to close the casino loophole. There is a piece of legislation that was introduced this year. We did get it passed through committee. And so we're hoping to still maybe get it passed on the Iowa House floor this year. And then if we can get that done, maybe working on it in the Senate next session. But that is probably and I've worked on some amazing pieces of legislation that have improved the lives of people in this state drastically. But that is the one piece that I'm incredibly
Right.
proud of because it's changed um, our environment. It's helped people quit smoking. It's improved the lives of the workforce. And it's probably just one single-handedly probably one of the most
Right.
important public policy changes that our state has made. Um, in
And
that
for those who don't know what we're talking about, I mean, this was in 2008, and prior to this bill, smoking was able to people could smoke publicly in most places. There were maybe some exceptions, but most bars, restaurants, public places accommodated smoking. And this was a bill that would outlaw smoking in public places, and it was very controversial, right?
It was, and it is so fascinating to think of today. And I tell you, the people who said, restaurants are going to close and bars are going to close and all these places are going to go bankrupt and people are going to lose their jobs and all of these sorts of things. And it couldn't have been further from the truth.
But it
The
was a real nail biter.
Oh,
I mean, the passing, it
to the
was,
bitter end, it
and
was.
and refresh my memory, had it been presented the year before and just not come up for a vote, sometimes, as you know better than I, legislation will be proposed and it just gets stalled and never comes to a final vote. And I can't remember if in 2007 it was debated but not voted on. Do you remember?
Yeah, so, actually in 2007, coming off the 2006 election, cycle, there was a change in the legislature, and we had a Democrat trifecta, and during that time, there were a couple of major pieces of tobacco control legislation that we'd been working on for some time. We had been working on local ordinances in communities to ban, smoking in public places, and so in 2007, we introduced the Smoke-Free Air Act at the state level to do it statewide, of course. And then, but we also introduced the dollar increase in the tobacco tax. And so the legislature in 2007 passed the dollar increase in tobacco tax, which again, another monumental and life-changing policy in its time. And then the next year they came back and did the Smoke-Free Air Act. So it was a couple of really, really big, important years for cancer policy and healthcare policy.
Right. And it was a nail biter. It was very close.
Yes.
And I think universally people, I suspect even those who voted against it think Iowa was a better place for having that smoke-free air act in as part of our law. And restaurants didn't close and bars didn't close, and business continues to thrive. You mentioned that one of the loopholes to get it passed was to allow casinos to be exempt. So I think they're the only public facility that is exempt from that law. And we feel that it's unfair. I mean, the people going there know that there's going to be smoking happening, but many people who work don't always have control to know to say I'm not going to work at that place. Sometimes their situation is such that that's their job. They need to go there, and they're being exposed to secondhand smoke. So this year, there's another bill that has been presented to try to close that loophole that allows casinos to allow smoking.
That's exactly right, and that's one that we haven't seen in a while, and so we really are very
And how's
grateful.
that bill coming along?
Yeah, so Representative Shannon Lundgren from, she's up in, she has a part of Dubuque County, and she actually owns a bar and restaurant in her community, and so she's been very passionate about this for some time. She's the chair of the House Commerce Committee, and she did say that was one of the reasons she came to the State House was to close that loophole, and so she's been a champion for it, and we're continuing to work with her to help move that along. So again, it's passed out of committee, and so it's eligible for debate on the House floor. So for those of you that are interested in that piece of legislation, I'd encourage you to reach out to your House member and tell them to move, support the bill. That's one of the things we've been challenged with as of late is really encouraging folks to get out and talk with their legislators about supporting this, and that's something she's asked us to help do within the Iowa House.
Okay. What other pieces of legislation are you actively looking at? And maybe give us an update on a few of them that you have clients that you're working on.
Yeah, so happy to. A couple that Dr. Deming, you and I have been working on this session is the pesticide bill, and that is a liability issue, otherwise known as the Cancer Gag Act. In a lot of circles, people in the cancer community have certainly been paying attention to that. So it's House File 394. Bayer has a product called Roundup that most people are relatively familiar with. The issue is really whether or not the label requirements meet and are transparent enough to suggest that if you get cancer is not caused by that product. And so this would provide immunity for Bayer from any lawsuits from anybody who might get cancer from use or exposure to the chemicals in that product. And so that piece of legislation is something that a handful of my clients do not support. We've been working against it because it wouldn't provide protections for everyday Iowans like you and me if we were exposed. And so it is currently passed out of the Senate Commerce Committee. However, it's been sitting on the House calendar for a couple of months now. Excuse me, the Senate calendar for a couple of months now. It does need to pass the entire Senate floor by April 4th in order to continue to be considered this legislative session. It is a highly controversial issue. If you know nothing about me or take nothing from this, as I am immersed, I feel like, in every controversial issue that maybe is at the State House. This is just an example of another one. And so that piece of legislation is still viable for debate at the State House, but one that we would certainly like to see go away.
And Teresa, you talked about the House and Senate, so let's remind everyone of how a bill actually gets passed before it goes to this governor to be signed. So it has to go through both the House and the Senate, and so you're talking about it's kind of in the Senate, hasn't passed. Has it already passed the House? But maybe talk about what the process is for a bill when it's first presented. How many different votes does it have to have before it eventually gets passed by either the House or the Senate?
Yeah. So before it would move to an opposite chamber. So when a bill gets introduced, it would get introduced in either the House or the Senate. It goes to a specific committee. It's committee of origin, wherever it makes sense. So they have an education committee, a health policy committee, commerce, which deals with like energy and insurance and those types of issues. So there's different types of committees that take on different types of issues based on categories. And so when it goes to that committee, it gets assigned a subcommittee, which is usually 3 members from that committee who vet and hear public input on that and decide whether or not it should move to the full committee. So that's a 3-member. They have to have at least 2 members that say to move it forward. From there, it would go, if that subcommittee moves it forward, then the full committee, generally anywhere from 15 to 23 members, depending which chamber they're in, would consider then that issue before the full committee. And it just needs to have a majority to move forward. So the full committee would consider it. If the full committee, for example, with the pesticide bill, the full committee, the majority did support it. It
In
was
the House,
no, in the Senate. There's only
in the
one
Senate.
bill. Yeah, great question. So right now, on the pesticide immunity bill, there's only one bill that has been introduced, and it is in the Senate. The House did not introduce a bill on pesticide immunity. So that bill is Senate File 394, and so it did pass through the Senate Commerce Committee barely, but it did. And so now it's sitting and it's eligible for debate on the Senate calendar. That means that its next move would need to be on the Senate calendar. So there's different deadlines within the legislature. So it met the first funnel deadline, which was it had to come out of a committee of the originating chamber, so the Senate, right? So in order for that bill to continue to move forward, it needs to pass through the full Senate and then through the subcommittee and the committee process in the opposite chamber. So that Senate file would need to pass the full Senate and then the House um, subcommittee and committee process by April 4th in order to remain eligible for the rest of this legislative session.
Okay.
So if that
Sometimes do they get introduced in the House and the Senate at the same time, and their work in parallel as opposed to go all the way through one chamber and then move over to the other chamber?
Yep, that's exactly right. So those are referred to as companion bills. So the same issue gets introduced. So a really good lobbyist would work to get companion bills introduced so that you're moving through parallel at the same time, because then you just need to get one through one chamber by the second funnel deadline and over to the other chamber, and then it marries up, and then they pass it and send it to the governor.
Okay.
And so, but this bill, because there wasn't a companion, it has to go through all the way through one process and then back all the way through the same process in the same time period. So sometimes it's a little bit more challenging when you don't have those companion pieces.
Right. So again, this is a piece of legislation we've been talking about that would give the manufacturer of this ag chemical immunity from any future lawsuits if their product is found to be carcinogenic. What let's go to another bill that we've talked about two. We've talked about the loophole for smoking in casinos. We've talked about the ag chemical bill. What's another bill that you're watching closely and working on?
Yeah, so a couple come to mind. So one that I'm super excited about today that we had a subcommittee on is the vapor tax bill. So as for those of you maybe that probably not using vapor or e-cigarettes, if you're watching this program, but maybe you know somebody that does, that we don't have an excise tax on those products, and so there's a piece of legislation that's been introduced at Senate File 475. It does not have a companion in the House, so it's only again only in the Senate side. And that was introduced by Senator Clemish. He's up in the Northeast part of the state of Iowa. And interestingly enough, a sometimes smoker himself, when we had a conversation last legislative session about the fact that there was not a tax on vapor products, he didn't believe me. And so he came out as an avid supporter here. And so what this bill would do would put an excise tax on vapor products and alternative nicotine products, which are the newer products that we see on the market, including the Zyn pouches or the products that use synthetic nicotine as a way, non-combustible types of tobacco, or excuse me, nicotine products, as an alternative to traditional smoking. And so many of these devices, because they're new to the market and because of how they're otherwise defined, they have not been included in Iowa's definitions and taxation system within that space. So these products largely came to the market starting in 2014, 2015. And so it's been, 10-ish years that they've been on the market without a tax. And there's several states now that have implemented excise tax on these products. And one of the things that we know here in Iowa specifically is that our youth's vaping rate or e-cigarette and alternative nicotine rate is higher than the national average. And also that a lot of people, this is kids don't necessarily think of using vapor products as tobacco or a form of smoking. And so they think of it as vaping, right? It's their vape. It's not smoking. They don't consider it in the same harmful manner as smoking a cigarette. But what we've found, and what I think, and Dr. Deming probably knows far more than I do in this space, but that a lot of people start vaping and then they get addicted to the nicotine and then ultimately marry up or eventually move to using traditional cigarettes because of the addiction. And so there's a variety of reasons. We know that vaping can cause popcorn lung, and there are other health implications that come, when in the early years, how many doctors recommended the Marlboros, I don't know for sure. But what I will say is that we didn't know the health implications of those products when they first came to the market and everybody was using them. And today we do, and we know the industry's dirty little secrets that they kept. And those are the industry, the tobacco industry, are the same very companies that owns all of these vape products. And so they still know that cigarettes are their number one sales. That is a fact, that they still make the most money off of a pack of cigarettes. They sell vape products for they're very cheap. I know I was at a gas station the other day and I saw you could get a vape cartridge for 99 cents. And so, and what we know is that often those vape cartridges are, can sometimes 3 times the amount in a pack of cigarettes for 99
Yeah.
cents. So super cheap.
There's also some concern about the effects of nicotine on a young brain, and that may have deleterious effects. It's separate from the addiction and separate from the cancer issue. I know another issue that I have been following, and I'm not sure if one of your clients is involved. It's the number of individuals in Iowa that have cancer that are getting their health care through the expanded Medicaid. So when we had our Medicaid expansion, one of the ways to make sure that everybody had some form of insurance is that individuals whose income was below a certain level could get their health insurance through the Medicaid expansion. And now there's a law that is being looked at that would put work requirements on individuals getting their health insurance through the Medicaid expansion. Can you talk more about that bill and where it's at right now?
Yeah, thanks for bringing that one up. And that one's just one that terribly breaks my heart because it provides healthcare access to so many Iowans that otherwise they would not have. And as you all know, that when people have access to healthcare, they have access to screenings, access to early interventions, and all of those things that can help us prevent future and disease in our state and for individuals. I represent a couple of different clients in this space, one of them being the free clinics of Iowa. And the free clinics have significant concerns about if this legislation is implemented and people lose access to their health care, that we're going to see more people show up in need of significant care at our free clinics. And free clinics are not meant to be a health home. They are meant to be a stopgap, intermediate and emergent. I don't want to say in an emergency situation, but to be a help to individuals, but certainly not a health home. And that's one of the things that the health and wellness program, since its inception, was really to help transition Iowans to ensure that they had a physician, that they had a care team that they could work with, that they had access to their medications if they needed them, early screenings, and all of those sorts of things. And if this gets wiped away, all of those things go away for a large number of Iowans who access this.
One of the other concerns that we have is that even though someone who is getting cancer treatment may be exempt from the work requirements, they still, by one version of the bill, would have to every month verify that they still have cancer and they're still getting cancer treatment. And the number of the burden, administrative burden that cancer patients have just with regular insurance and trying to keep up on that, and then to once a month get your doctor to write a statement that says, yeah, you still have cancer. Yes, you're still getting cancer treatment. It would just be a huge burden on top of the burden of going through cancer treatment. Where does the legislation stand? Does it have companion bills that are going through the House and Senate? And has it cleared the subcommittees and committees?
Yeah.
And
So it has. It does have companion bills in both chambers, unfortunately, and it has passed the first final deadlines. It has been referred to the appropriations committees in the chambers. And so tomorrow, actually, morning at 8 o'clock, there is a subcommittee on the Senate side to have this bill go through the appropriations committee and the appropriate. So there will be a subcommittee tomorrow morning at 8 a.m. on this bill in particular. One of the things that we've really challenged legislators to look at, Dr. Deming, as you really stated, is the red tape and the burden that it really places on everyday Iowans who sometimes have significant medical challenges, disabilities, and a whole host of potential conditions that have forced them to have to be in a position to be on a health and wellness plan. And searching for work when you are sick and going through, whether it be a cancer treatment, any treatment, right, or have a disability and having to be forced or having to work, right? That's the other thing, right? Like having a work requirement for these individuals, even though they say that there is there's a whole group of people that it exempts. There's not clear definitions in the bill as to what is included in that exemption and what is not. There's another piece of legislation out there that is moving forward as well that does have companions is Work Without Worry. So I don't want to confuse the two, but those two bills are almost they very much are contradictory of each other, because Work Without Worry says that if you have a disability, you can go earn a living and not have to lose your benefits, because you're out there working more than, 10 hours a week or 20 hours a week or whatever is that cap. So you wouldn't lose your benefits, right? Because if you hit a certain threshold, you're at risk of losing that health and wellness plan benefit, right? And so people want to work. I mean, I think that's what we know, and generally, and one of the biggest points that's been discussed, in particularly about this bill that has work requirements for Medicaid or the health and wellness plan in particular, is that 76% of Iowans that are able and capable of working, that are on these types of plans, are working. And the other 25% are generally caretakers, individuals with disabilities, or a disease or condition that doesn't allow them to work. And so very, very small portion is actually people who are, gaming the system. And we're never going to have a perfect system where there's a bad apple in every bunch, I guarantee it. And but we're legislating good. They're trying to fix really good policy and sour it for everybody, and so it's very unfortunate. The other thing that I would just say about that real quick is they haven't looked at the actual cost for oversight of implementing a program like this, and it's at a point in time when the state budget shortfall will be considerable the next fiscal year, that we would be putting more costs onto the state to come up with additional resources, just to more than what they would save by implementing this policy. So again, personally, I think it's very short-sighted.
Um, one of the causes of cancer, a modifiable risk factor, still the number one modifiable risk factor, is cigarette smoking. And we know from public policy research that the best way to decrease the number of smokers is to increase the cost of cigarettes. And you pointed out in 2007, we increased the price of a pack of cigarettes by $1 and increase the tax. We haven't done that since 2007. So compared to many other states, the cost of a pack of cigarettes in Iowa is low, and that we could reduce smoking if we added another $1 to the excise tax on a pack of cigarettes. I know that there was a bill that was going to be introduced. Was a bill introduced? Is it gone anywhere? Has it had a subcommittee or committee hearing? Are there companion bills going through both the House and Senate? Maybe a little bit of an update on the tax bill for a pack of cigarettes.
Yeah, unfortunately, there was not a piece of legislation introduced specific to a cigarette tax this year. I know that there's legislators that have been interested in that. One of those being Senator Clemish, who instead decided to introduce the vape tax instead, to bring some equity among those products. Today in that subcommittee, there was a request to include an increase in the tax on tobacco as well, as this moved through the process. And so that could be, because they're in the same code section, it would be germane to the discussion to actually increase. So that would certainly be a vehicle. So Senate File 475 would be a vehicle where a cigarette tax could be included. And you're exactly right, Dr. Deming. The Iowa ranks 32nd out of 50 on the rates for tobacco tax. So our tax in Iowa is $1.36 per pack, but we rank 32nd in the country. So
And we're second in the nation in terms of incidence of cancer. So
Yep.
Yep. You know what? We're going to open it up for questions. So we have a live studio audience here with us. They get to ask the first questions. But if you are watching us live streaming and you have a question, you can put your question into the comments section of the software you're using to watch us. So any questions, fair game. We can talk about lobbying in general, or we can talk about specific legislation. First question.
We've got a question from one of our viewers on Facebook. Patrick says, let me see if I can bring this up. He says, we're still dealing with issues where insurance companies deny tests, treatment, of therapy recommendations by oncologists, and the denial reasons state, not medically necessary. Why is that? Why is it that insurance companies can make that determination?
Okay. Teresa, do you want to, I can answer that, but you want
You
to answer
know,
it from the lobbyist perspective?
I'm happy to, it's one of the things that I work on a regular basis is I go up against insurance companies regularly, and it's very, it breaks my heart because they have a lot of political capital because they make a lot of financial contributions to policymakers each and every day, and it makes my job really hard, but one that I remain passionate about in particular, and I know that, and I've worked with a lot of um, individuals with cancer. Have represented the breast cancer groups and the Komen Foundation up at the State House too. And those are some of the issues that we bring. And typically, insurance companies will say their reasons that things are not medically necessary is because they have a physician group or they have professionals on their staff that they pay to decide whether or not they're going to cover something. And it is in their professional opinion on whether or not something is medically necessary, despite what your individual physician or healthcare provider has recommended. They have a different opinion and they get to make a decision based on the fact that they're paying the bill.
Yep. And so the reason there is to try to standardize medicine and make sure that everything that's being done is in the patient's best interest. So that's kind of the stated reason. Another reason which they wouldn't state, but which is true, is that if they limit testing, their profit will be higher. So if you follow the principle of follow the money, I mean, that's what's we're concerned about, is a couple of things. One, they make the burden of getting the approval very difficult. So they're hoping that some doctor's office just won't put through the request because it takes so much paperwork and time and effort to even get the authorization. And then second, if they do disapprove it, you can sometimes get it approved by appealing, but again, it takes the doctor and the staff lots of time to go through the whole process. So the more difficult it is to get a study approved, the people will stop ordering it, and there will be an increase in the profit that the companies make. So the stated reason is to try to standardize and improve the quality of care, but unfortunately, the practical reason is the more difficult they make it, the higher their profit will be. So we're concerned about that. Right now, there's some legislation being proposed at the federal level having to do with Medicare Advantage plans. So Medicare Advantage plans, which were intended to help streamline those of us who are over 65. But what we've seen is that those programs, regular Medicare, you don't have to get pre-approval for testing. You're just expected to follow the rules and you don't need pre-approval. The Advantage plans make their money by they get paid per patient per day, and if they don't spend all of it, then there's a profit. So they have instituted lots of authorization. So we're concerned about that as well. So I thank the viewer for asking that question. Next question.
First off, I just want to say thanks for all your efforts. I mean, it's a big job, and especially that smoking one. That was pretty cool. Never thought those things would be able to pass. But in reference in a particular bill, that pesticide bill, you've got a big company that you're going against, and I know there's regulations on this, but how do they funnel money to the legislatures to sway them?
That's a great question, and it's interesting. I had there was a lobbyist this week who was chatting me up out in the lobby, which is they're just a rotunda where we wait for legislators, and he said we've got to get money out of the system, and I said I couldn't agree more. Most because I represent a lot of nonprofit. I mean, I do represent some corporate organizations as well, but I do represent a lot of nonprofit organizations and associations. How do they get the money? Campaign contributions. So there's lots of ways to give campaign contributions, not only to individual legislators. Each of the parties have funds that corporations can give money to through PACs and all of those sorts of things. So yeah, they funnel money to legislators and specifically to parties, Republicans and Democrats alike, to help move their pieces of legislation forward. So that's how they do it.
And if, for example, this particular company's Bayer, if they make a campaign contribution, does that have to be recorded? Does the company have to state they made a campaign contribution? And does the lawmaker who received the contribution have to disclose the contribution?
Yes. So there are disclosures, right? There is transparency in that giving, and there's so those you can see which legislators received the campaign contributions and who didn't, right? You can also see they often will have, whether it's if I'm an executive of a company, I might give a personal contribution in addition to the our PAC giving a contribution, in addition to our corporation giving a contribution through their 527. There's lots of different layers. They don't all require disclosure, but most of them. But there's lots of ways to do it. I said earlier, there's lots of ways to skin a cat. There's lots of ways to make contributions and give significant dollars. By way of your employees, by way of your PAC, which is a political action committee that organizations and companies can have. I manage some of those for my clients. They're not significant in the big grand scheme of things, but so there is disclosure and transparency for most of them, not all of them.
Okay. Well, unfortunately, we've run out of time. So we'll have to have you back again. Our guest has been Threase Harms, and she is president and CEO of Advocacy Strategists, a lobby group that deals with public policy. And so this has been great. I appreciate all that you do. And I've really enjoyed being up to the State House with you, helping to, in my case, educate so that we can make sure that they're making the best decisions possible. Thank you, Threase.
Thanks, Dr. Demi.
If you know someone that would enjoy watching this program, it will be available on demand beginning tomorrow at the Above and Beyond Cancer YouTube channel or the Mercy Cancer Center website. I hope you'll join us again next week. Thanks, everyone.